Hello, YouTube. This is Brian Archuleta, Senior Long-Term Care Clinical and Scientific Liaison with Otsuka Pharmaceutical Development and Commercialization. Recently, PsyQ hosted a webinar titled Burden and Treatment Considerations for Agitation Associated with Alzheimer's Dementia. During the discussion, our speakers discussed patient, caregiver, and economic burdens of agitation associated with Alzheimer's dementia, as well as non-pharmacologic and pharmacologic treatment consideration and gaps. As always, the presentation was sponsored by Otsuka Pharmaceutical Development and Commercialization, Inc. and Lundbeck, LLC, committed supporters to the mental health treatment community. Speakers are paid consultants to OPDC, and I am an employee of OPDC. Let's look at a few clips from the webinar.
Now, you mentioned neuropsychiatric symptoms. I want to dive a little bit into that. We think of dementia as a disease of cognition, and yes, at its core it is, but there are other neuropsych symptoms which manifest in patients who have Alzheimer's dementia. Agitation is one of those, depression would be another, anxiety would be another, and so some of these things occur. So if a patient with Alzheimer's has anxiety, is it comorbid generalized anxiety disorder, or is it a manifestation of Alzheimer's? Well, from a practical standpoint, you may treat it similarly regardless of the source of anxiety. But, one important historical clue is just look and say, how long has a patient had that? If they've had anxiety all their life, it's probably GAD and probably not attributable to Alzheimer's. But if they just have anxiety after the diagnosis of Alzheimer's dementia, then it may be a neuropsych symptom that's attributable to it. Let's calm down and look at agitation. You mentioned that 30 to 60% of patients who have AD or Alzheimer's dementia may have agitation. Look at this study. This is a study that I found personally quite surprising. 53% of nursing home residents with Alzheimer's dementia had agitation. That did not surprise me. Here's what shocked me. Fully 1 out of 2, 45% of patients that were indwelling in the community also had agitation. I wasn't surprised that 1 out of 2 in the nursing home had it. I was shocked that 1 out of 2 walking around in my practice had agitation. Also, if you look at the rightmost portion of the slide, you'll see here 3 bar graphs. You have mild, moderate, and severe disease. And as you see, there's a good number of patients who have severe disease who have agitation, 68%. But wow, look at moderate to severe. Milder disease still has a high prevalence of agitation, 75% in this study. And then even mild patients, the mildest category, 56% of those patients had agitation. So 2 key learnings from these studies. Number 1, agitation is not just for institutionalized patients. It's not just for people in a long-term care facility or an LTCF environment or a skilled nursing facility environment, SNF. And also, you don't have to have severe Alzheimer's to manifest agitation. Mild and moderate patients also have agitation as well in relatively high prevalence.
And so we've got some data here that's going to show us, like, if we have agitation associated with Alzheimer's disease, the burden that can come from that. So in this particular cohort in this study, looking at folks, whether or not they stay home or in the community or hospitalized, you see 2 times more visits if agitation is associated with their disease than it's not. And if we talk about institutionalization, which is a term I don't really care for, because being in the long-term care space and working there, maybe that's not the correct, but it's a term that we need to be aware of because it's going to be utilized in research. But what we see there, what we're talking about institutionalization, as Clay said earlier, is placement into a long-term care or a skilled nursing facility. You see a 3.7 times higher rate with agitation versus those without. So the addition of the agitation, again, it can add significant burden not only to the individual and their quality of life, but also the caregiver and the family members and everybody that's associated with taking care of this loved individual. So we need to be on top of that. On the right, we're looking at a community-based study, again, looking at medication utilization. And we're talking here about psychotropic medications and breaking it down. We talked about the idea of MPS and some of the other diseases that folks can suffer or behaviors that folks can feel. And we see increased use in the agitation group versus the non-agitated group in terms of antipsychotics, antidepressants, benzodiazepines. Now, all these medications, again, aren't approved to treat agitation, so we need to keep that in mind. And they're also associated, again, with burden in terms of cost, quality of life, adverse events, and it really, again, adds to the burden of an already burdensome disease. Thank you for watching our YouTube teaser. If you'd like to watch the entire presentation on psychu.org, please click the link in the description. You can take a look at our upcoming webinars while you're there as well. Be sure to follow us on Twitter, LinkedIn, Facebook, and Instagram, and have a great day.